The number of Americans who are considered obese is over 41%, and the rate is still rising. In the past, people who were obese were considered to have a lack of willpower or discipline. But in 2013, obesity was designated as a disease, and that gave doctors new ways to combat obesity, including drugs usually prescribed for other conditions.
There are different medications that are now out there that can help people lose weight. So the number one molecule that we've been using is GLP. So GLP-1 agonists, what they do is, from a diabetic perspective, they increase insulin, and that will help people lower their sugars in their body. But the key component why it's been so popularized is that they have food stay in the body longer. So it makes patients less hungry by chemically constricting the stomach and decreasing their appetite.
Besides medications and gastric surgery, doctors are now looking at non-medical treatments to help patients evaluate their eating habits and lifestyle. That may include seeing a behavioral therapist and a nutritionist. And as far as keeping the weight off, the number one way is exercise.
It's been proven time and time again that weight loss itself comes down to food in and what food you take. But keeping the weight off is all about how much exercise you do. So 30 minutes of exercise per day, around 5 days a week, should help people keep the weight off.
Treating obesity is not just about diet and willpower anymore. It's evolved to give doctors the ability to treat all aspects of the disease.
In today's day and age, we treat people who have a disease process. We're here to help you. We're here to care for you. We're here to make you better. We realize what you've been through. We realize the disease is there. The disease is real, and we're here to make you healthier.
For 20 years, Amy Christopoulos worked as an educator for the Miami-Dade County Public School System, the third largest school district in the country. She spent 10 years teaching science before becoming an administrator. She also served as the district's homeless liaison. She is now the Director of Development and Communications for a charter elementary school in the district. Christopoulos says she enjoyed teaching, but like most teachers, she was unprepared to deal with students struggling with grief, loss, and trauma. For 2 years, she worked in a high-poverty, high-crime neighborhood, and she says many of her students in this predominantly Black community had either experienced or witnessed the death of a loved one or acquaintance, often from traumatic events. She also had to deal with the death of several students, including Trayvon Martin, a Black teenager who was killed in 2012 by a neighborhood watch volunteer while walking home from a convenience store. The death of this unarmed teenager rocked the school community and sparked national protests.
So as a teacher, I had 19 students die in 10 years in Miami-Dade, which is very high.
Christopoulos marveled at her students' resiliency, but was troubled by how numb many of them had become to death. She vividly recalled an encounter she had with one student that shook her to the core. The student, who was about 14, appeared withdrawn in class, so she asked him what was wrong.
By the middle of the day, he was able to share what he had seen the night before. He came home to his mom, who had overdosed, had a needle in her arm, and his baby sister, who was like 1 or 2, mom was holding the baby in one arm and had a needle in the other, and she had died. So when he came home from school, that's what he witnessed. So he picked up the baby sister and he went to his aunt's house, who lived in the neighborhood. The next day, he had on the same uniform. And he came to school and he came to my classroom, and, it was by lunch that he finally told me what was going on. And he said, "It's no big deal, miss. I got it handled." And I said, well, did you report the death of your mother to anyone? He goes, no, who would I call? Like he didn't really know who to call. And he said, I took care of my baby sister and she's with family and we're all safe. And he said, and I'm going to get some new uniforms this afternoon from one of my cousins.
The COVID-19 pandemic substantially increased the number of bereaved children in the United States. As of March, researchers estimate that over 350,000 children have lost one or both parents or a grandparent to COVID. 60% are from minority communities. Florida has the largest number of Black children bereaved from COVID and the third largest number of bereaved Hispanic children. Black and Indigenous children, two communities that have historically suffered from trauma, have the highest rates of caregiver loss to COVID. Although American Indian and Alaskan Native children only make up 1.4% of the U.S. population, they bear the greatest burden of parental and caregiver loss to COVID. Followed by Black children, Black and Indigenous communities also have the highest death rates from drug overdoses and homicides from gun violence. Experts say this is a result of years of neglect and disinvestment in communities of color, poverty, structural racial inequities, and ill-conceived policies that focus on punishment rather than prevention. Child advocates say schools cannot expect the growing number of bereaved children to carry on as normal when many of them are emotionally wounded from unaddressed grief and trauma. They say the pandemic has magnified the need for schools to become grief-sensitive environments and to rethink their approach to school safety. Kevin Carter, a bereavement consultant based in Maryland, says overwhelming feelings of grief, loss, and fear can turn into rage.
And then that rage turns into sometimes consciously hurting other people and hurting yourself. There has to be some recognition that this is a public health and a safety issue.
Dr. David Schoenfeld, a renowned developmental behavioral pediatrician, explains that losing a parent or loved one can significantly affect children's emotional, social, and behavioral development and overall health. But with appropriate support in a nurturing environment at home and in school, they can develop healthy coping skills and thrive. The problem is, many children do not get the support they need.
I had one child whose brother died, and he wasn't getting the support that he needed because his mother was overwhelmed, and she was poor, and she single parent. She had one child die after a bone marrow transplant. It was a very complicated story. So the kid didn't get the counseling that he needed, and the school didn't provide him the support that he needed. And so he was like 12 or something. He was just finishing elementary school. He stole a car, parked the stolen car in front of his apartment, and waited to be arrested. He went into the juvenile justice system because that was the only way he was going to get help. I mean, it was a cry for help.
Rita Milburn Dobson, a thanatologist who specializes in dying, death, and bereavement, says adults often do not acknowledge children's grief because on the surface, they may appear to be resilient.
People always say that children are resilient. And that's kind of our easy way out. What I mean by that is because children don't experience grief the same way, or they don't display grief the same way as we do as adults. We think that they're okay. For instance, a child will hear about a death, they'll cry initially, they'll go out to play. They get on a video game, they'll do some other activities, and it seems like they're normal. They don't talk about it, and so we think, oh, they're doing really, really good. And so we move forward, not realizing the impact that it has on them. It's manifested oftentimes in the classrooms with behavior problems. And if they had a behavior problem before, it's exacerbated, and the teacher doesn't say to them, do you want to talk to the counselor? Do you want to, they say, that's it, you're suspended.
Research shows Black students and students with disabilities who act up in school are more likely to be suspended and receive harsher punishment. Christian Harper, the Vice President for Public Policy and Engagement for Child Trends, says schools need to shift from an authoritarian, punitive culture to a culture of healing and support to better serve children in distress.
We are more comfortable punishing Black children than serving Black children in schools. And I would say that to the extent, we see that discrepancy within our school systems, that it's reflective of a broader societal challenge where we are comfortable punishing Black communities, incarcerating Black communities in lieu of providing services and support. Our focus needs to be on examining the underlying causes of those behaviors and addressing those underlying causes. It should be on making sure that schools have the capacity to provide services where children need services, and it should be on building relationships. Every time you suspend a child, you worsen their academic outcomes, you worsen a range of just life prospects for them, and you damage their connection to their school environment.
Educators not only need to know how to identify the signs of grief and trauma, Harper says, but how to de-escalate situations when children act up.
They're sending children to the hospital when they have externalizing behaviors because they don't know what else to do.
Schoenfeld says there is a myth that if you talk to children about a death, you will upset them. But children want to know that the adults in their life care.
A lot of people say, I don't want to say anything because I'm not trained to do this, and I'm afraid I'm going to say the wrong thing. So if I don't know what to say, it's better to say nothing. And I look at them and go, well, saying nothing is exactly the wrong thing, because it communicates to kids that either you are unaware, you're unconcerned, you're unwilling or unable to be of help. And those are all horrible messages for kids to receive from those that they count on to support them.
Schoenfeld and Christopoulos say grief training should be mandatory for educators and school personnel.
I think everyone should have these trainings. And here's why. We never know which adult in a schoolhouse the student is going to go to. It could be the bus driver. It could be the cafeteria worker. It could be the security guard that just says hello to them every day when they walk through the school door. So for that reason, that's why it's like everyone in the schoolhouse has to be trained on death and how to assist a child.
The alarming increase in mental illness among children during the pandemic and the surge in gun violence prompted Congress to pass bipartisan legislation to increase funding for school-based mental health services and staff, but the number of school counselors, psychologists, nurses, and social workers in the nation's schools remains woefully insufficient. And some bereavement experts are concerned about people conflating grief with a mental illness, which can result in children being unnecessarily medicated. Miami-Dade's school psychologist, Frank Zanieri, addressed this issue.
Grief is not a disability, and it should not be seen as such. It's not an affliction that descends upon somebody. It's a life experience, and that's wholeheartedly different than a mental illness. It's a natural expression of emotion and behavior based upon a loss. We have to confront it and deal with it, I think, head on in order for us to make some headway to alleviate some level of suffering that children are experiencing endlessly. They don't have to go down that road alone.
This is Shirley Smith reporting. This project was supported by the National Geographic Society's COVID Emergency Fund for Journalists.
His parents had come to Canada on the Underground Railroad. They didn't talk much but about the slave days.
More Smart Life after this. You're watching The Smart Life on the Health Channel on South Florida PBS. If you'd like to learn more, please visit the Smart Life page on our website at allhealthtv.com. If you have a question for our experts, please visit the Ask the Experts page or give us a call at 855-796-4475.
Don't forget to download the Health Channel app. It's available free at the App Store or on Google Play. Follow us on social media at AllHealthTV on Facebook, Instagram, and Twitter.